Well, hello. I'm Dr. Cliff Robertson, and this is a second update concerning the ongoing negotiations between Blue Cross Blue Shield of Nebraska and our clinically integrated network called Uninet. I thought I'd try to respond to a handful of questions that I've received over the last couple of weeks and do it via this format. One of the first questions that's come up over and over again is, how did this contract termination come about? Well, the actual answer is we spent multiple months, more than 9 months negotiating, and in February of 2014 came to agreement and had a signed contract with Blue Cross Blue Shield. Then within just a couple of months after that negotiation and that agreement, Blue Cross Blue Shield decided to terminate the contract to essentially reopen the negotiations. What does the termination really mean is another question that I've been asked. So the simplest way to think about this is that if this termination comes to pass, meaning that if we don't have a new agreement in place before the end of August, our Uninet physicians, the physicians and hospitals that make up Allegiant Creighton Health will be out of network, as well as our hospitals. They're in St. Francis, they're in Kearney, Grand Island, St. Lincoln, and Nebraska City. So the impact would be that patients would be subject to higher out-of-pocket costs if they wanted to maintain their ongoing physician relationship. The third question that's come up is, what have we put on the table? What are we trying to do to resolve this? So the way I would answer this is similar to what I've said before. We have already put significant reductions, cost reductions, rate reductions on the table. And as I've said in the prior video, what we've said is we're willing to work with Blue Cross Blue Shield not only to address short-term costs, but commit to lower longer-term costs, but it needs to be in exchange or part of a value-based model. So that leads to the fourth question, which is, what is this value-based model? In the simplest form, it's easiest to think of it as a partnership relationship between the delivery system, between providers, and between the payer. Again, our goal is to align payment with quality and outcomes, not just with activity. So what this new relationship will require is that both the Uninet and the hospitals and physicians that make up Uninet and Blue Cross Blue Shield sit down together, work together to develop the best ways to provide the most cost-effective, high-quality care for our patients, for the members that are also the members of Blue Cross Blue Shield. So it requires a different relationship, and that's the key issue here at stake. Now, we've heard that Blue Cross Blue Shield has said that they're willing to partner with providers, and we're hopeful that they truly mean that. We believe that, and most people in the country believe, that the future is the integration and the alignment of physicians and hospitals, acute care facilities, hospitals, outpatient surgery, all of those different venues and or providers being aligned, one team working together along with the payer and the patients to really improve the quality and the outcomes, and do that in a way which is cost effective. That's the future. That's where we're trying to go, and we're hopeful that Blue Cross Blue Shield will join us there. So thanks for your questions. I'll be back again in a week or two and update you as needed. Thanks. Bye-bye.